From December 2022 until November 2024, Phase 1 of Te Tira Ārai Uruta, the Royal Commission of Inquiry into COVID-19 Lessons Learned, looked at Aotearoa New Zealand's response to COVID-19. The inquiry looked at how prepared the New Zealand government was for a pandemic, and the methods they used to manage the COVID-19 pandemic in New Zealand, like the elimination strategy, lockdowns, border closures, vaccination, and mandates. Phase 1 also looked at how the pandemic affected the healthcare system, our economy, and our society. We heard from government departments, organisations, and members of the public from across Aotearoa New Zealand about their experiences during the COVID-19 pandemic. Phase 1 found that although Aotearoa New Zealand could have done better in some areas, overall we did very well in managing the pandemic. Like many other countries, Aotearoa wasn't ready for the scale of COVID-19, but we did adjust to meet the challenge, and dedicated people across government worked hard to respond quickly to COVID-19. The government started with a clear strategy, but they could have done better as the pandemic went on. They needed to work more closely with businesses, iwi, and communities. Lockdowns helped keep COVID-19 out at the beginning. Although there were challenges in putting lockdowns in place and managing them, and they were harder on some people than others, iwi and community groups were vital in supporting people during lockdowns. If we put more money and time into other public health measures, like contact tracing, we might not need to use lockdowns as much in a future pandemic. Border closures helped keep COVID-19 out, but they were hard on many people, and the government often faced challenges setting them up and managing them, like not always having enough rooms to meet the demand. The MIQ system was set up very quickly, which was a huge achievement. The healthcare system wasn't ready for a pandemic. During the pandemic, access to regular healthcare was disrupted more than necessary, and the pandemic made existing problems in the healthcare sector much worse. However, the government's actions successfully stopped the healthcare system from being overwhelmed, although there were costs to these actions, like people not being able to visit their loved ones in hospital. Although the government did provide a lot of effective social and economic support during the pandemic, it made a lot of the existing social and economic problems worse. The pandemic was more difficult for some people, and many still need support. Vaccination saved more than 6,500 lives and prevented more than 45,000 hospitalizations. The process for getting and approving a vaccine was appropriate, and an enormous amount of effort went into the vaccine rollout. It took too long for some vulnerable groups to get their vaccines, partly because the vaccine rollout was late to involve Māori and Pacific health providers. Some people were hesitant to get vaccinated, found it hard to access, or did not want to for a range of reasons. Mandates were challenging and caused some tension. Testing, contact tracing, and masking mandates were reasonable, but the way they were implemented could be improved in future pandemics. It was reasonable to introduce some vaccine mandates based on the information available in 2021, but some workplace, occupational, and other vaccine requirements were applied too broadly and remained in place for too long, which caused harm. Phase 1 of the inquiry was asked to make recommendations to the government on how Aotearoa New Zealand could prepare for and face future pandemics. We don't know when the next pandemic will happen, but it will happen. So Aotearoa New Zealand needs to be prepared. Our recommendations are to create a pandemic plan where all government agencies work together. Establish a group within a central government agency to coordinate pandemic preparedness for the government. Make sure our health, social, economic, education and justice sectors are ready to face a future pandemic. Involve experts in pandemic planning and responses who will protect human rights and help focus on long-term outcomes. Make sure any future pandemic response is people-centered and work closely with communities and organisations throughout Aotearoa. And during future pandemics, the government should listen to concerns from around the country and be clear about the reasons behind their decisions. The Phase 1 report is with the government, who will decide which recommendations they will put into place. Read the full report on the inquiry's website. Thank you to everyone who made the work of Phase 1 possible.